Big thank you to Chris and Angela for joining us today. Our topic is managing inspections in a COVID-19 world. So how do we actually still keep our inspections programs going, effective with limited resources, and also this constant risk of danger in breath and air that we're breathing here. So I'd like to thank both of our panelists for joining us today, and I'm excited to jump in here with them. So I'm going to have our panelists just quickly introduce themselves, speak a little bit about their current involvement with their responsibilities in their institution's inspections program, and then we can jump on into the questions. Just a reminder for everybody who just joined or hasn't heard this yet, but we have a Q&A function here in Zoom webinar. If you go down to your Zoom control panel and click on the Q&A button, that's a great place to ask the questions that you're interested in us addressing. There will be a live Q&A about halfway through this webinar. We'll be able to address your questions, and then you can also thumbs up the questions that you're most interested in, and also reply to each other's questions, and that way you can have that. So Angela, and Chris, just a quick heads up about how Zoom works. When you type a response, unfortunately, that does kick it over to the answer tab. So we can still go to those things as we're interested in as the topics go, but just a heads up, it's a kind of unfortunate thing that you guys can't actually respond in text to these without Zoom thinking that the question is all set. So we'll revisit that, but just a good warning. And Chris or Angela, if you'd like to go ahead and get us started and let us know, a little bit about yourself.
Hi, I can go ahead. Hi, my name is Angie Dartt. I'm the Director of Chemical Safety at Washington University in St. Louis. The Chemical Safety Division is part of our larger Environmental Health and Safety Department. And current involvement and responsibilities around our inspection programs. So my group actually inspects the research laboratories on both of our campus locations, our medical campus, as well as our Danforth campus, which has our traditional programs such as engineering, chemistry, biology, and any other arts and science programs. We inspect about typically close to 700 PIs annually, which is around 4,000 lab spaces. And we have had this inspection program in place for probably upwards of 15 years. I've only been at the university about 2.5 years. And so we're making kind of some changes as we go. In addition to the inspections, my team evaluates fume hoods. We provide or oversee the lab health and safety training, manage the chemical inventory, and just the related programs for our laboratory health and safety, and then engage with the other divisions that are part of EH&S, which include environmental compliance, biosafety, radiation safety, and then our traditional occupational safety group that's looking at traditional hazards on campus.
Good, Chris?
Yeah, I'm Chris Kolodziej. I'm the Chemical Hygiene Officer at UCLA. So in terms of our inspections, my responsibilities there, it's, assigning them out to the team, training folks, checklists, and then in rare cases, interacting with the faculty committee if something does need to be escalated. But then, very similar to what Angie was talking about, in terms of the chemical safety group, we spend a lot of our time on training and outreach to the labs, trying to make that really the focus of our interactions with them.
All right, great. So we are going to jump on into our prepared questions here, and about halfway through, we will switch over to a live Q&A. Once we have gotten through all of the questions we have, and so looking forward to hearing your thoughts as well as we go through this. First question here to both of our panelists. What have you found as your most limiting resource when it comes to handling inspections, and what have you done to work around that?
Sure, yeah, so I can go. For us, the most limiting resource has just been our ability to get into the labs, having access in there. We've been at what we call our tier 2 for reopening since June. And, the guidance from our Vice Chancellor for Research there is that, labs should be at no more than 25% occupancy. So you can do the math and pretty easily figure out that it's impossible for the labs to really be operating at full speed with that kind of an occupancy restriction. And so our sense has been that if we're going to go in there and do a traditional inspection, that's probably going to shut the lab down effectively for half a day or so. And given the burdens that the researchers are already under, that's just not something that we want to be doing. So we also have, during this ramp up, been tasked by the campus leadership with going in and performing spot checks, making sure that labs are complying with their COVID ramp up plans, campus guidelines for infection control. And so, we've tried to kind of, navigate between these two, things by completely reimagining, what we're in there to do. So, we don't spend time when we go into the labs looking at, doing a deep dive into someone's chemical storage cabinets. We've really been there trying to, make sure that we are, there to provide resources to the researchers. And so, want to keep these visits down in like the 5 to 10 minute range. Make sure that we're not introducing a whole bunch of additional close contacts. So one of the other things that we've been doing is we printed up some sheets with a bunch of QR codes that labs can scan, which directs them to a bunch of the different resources that our campus has made available. So it will show them where they can go for general COVID information. It will show them where they can go to get PPE, to get some other lab supplies that might be in short supply that we started providing as a campus. Mm-hmm. And it includes contact info for the inspector who's been going around, so that they actually have a person that they can go to get help if they need it. While we're in there, we do check for serious problems. Make sure that there's nothing imminently dangerous. But that does mean that there's a lot that we just aren't able to check up on. And so one of the things that we will be doing very soon is launching a self-assessment program. And so in that, we've kind of pared down our traditional inspection checklist. We're going to be providing this to the labs, asking them to complete their own self-assessments, and then offering to conduct a Zoom meeting with them afterwards if they want to discuss what they found.
Great. Sounds like a pretty thorough process there, and definitely interested to learn more as we get on here. Angela, what have you found that you have as your most limiting resource, and have you had any success in kind of working around that?
Yeah, so honestly, I feel like I would say time. So just as far as, I'm going to give everybody a high level overview of where we're at, because I think Chris and I are probably in a little bit different situations depending on where we're located. So we ramped down the week of March 23rd here at Washington University. And beginning the week of May 20th, we began our phased ramp up. And so we've been phasing through those stages, and we're now at what's called yellow. We actually went from our orange to yellow phase after we came back to campus early July, so July 8th. And that actually allows for up to 80% of research activity to be resumed in a space. It doesn't mean necessarily 80% density, but that they should be able to do 80% of their research activity. So we're in a little bit different situation here. We have a lot of activity on both campuses. Therefore, starting around in May, we had tooled to a ramp down and support mode for the pandemic response. Then starting in May, we needed to start to, tooling back up to figure out how do we now start supporting the labs that are coming back online. It's really varied. Some labs, I would say there's hardly anyone on campus and they're just doing checks, where other labs, depending on the research they're doing, they could be at that 80%. And so before COVID, time was was our most challenging factor associated with conducting inspections, because you never feel like you have enough time to get through all them. And now time is a challenging factor because we're trying to limit time in the space. So before, when we wanted more time to be able to do an inspection and engage with the researchers, now we're trying to do all of that in less time. And so what we're trying to do is more upfront work, leverage our systems that we have so that we're able to review as much as we can from a documentation standpoint and training standpoint and chemical inventory and protocol prior to going, having that correspondence with the lab contact, scheduling it with the lab and working with the lab on when is the best time to have this inspection. So typically, you know, early morning or maybe later in the afternoon, there's not as many people around. So that helps us avoid some of the density concerns. And, you know, we are in the lab as of the start of our fiscal year. We started our fiscal year 21 inspections a little bit delayed. So they started kind of mid-August into September, depending on where we were at. And they're relatively standard how we were doing before. But we're trying to limit that time in the space and also maintain distancing. So kind of like Chris mentioned, we want to make sure that we're not causing any concerns with close contact. And so typically where we'd want a lot of engagement with the lab people and a lot of participation, that's not something we can really have this time. So it's typically limited to engagement with our primary lab contact at distance. And then we'll typically just say, hey, you know, we'd like to just kind of walk around. We're going to look for a few things. We'll circle back, or we can touch base later via Zoom or phone. So that's kind of what we're trying to do. Time's also challenging because we have to be so much more careful about scheduling these. Before, we did have circumstances where we just show up. We can't do that now. And, you know, certainly out of courtesy. But we have noticed that it's a little bit more challenging to schedule because there's fewer people in the space. And so we've noticed our cycle kind of gets pushed out a bit. So we're just trying to be flexible and, you know, work through the limitations and be flexible with our lab, you know, our research partners, and still be able to try to provide them, you know, a good service, right? And we're helping them try to identify their hazards. But, you know, I think time for us has certainly been a challenge.
Yeah, it definitely sounds like for both of you, inspections have become particularly disruptive, just with the increased effect of having fewer people working in the labs means that, you know, any disruption is kind of magnified, and also just the inspection itself, regardless of anything else, is more disruptive. And doing pre-work is really important, and then also that kind of scheduling coordination really matters a lot.
Yeah, I just will comment on that. I will say though, you know, because we've been communicating with the labs this whole time, and we've really been trying to be a resource for them, that so far our interactions with the labs have been very positive. And a lot of times they're honestly really happy to see us because they now have this person, like this captive person that they can ask a lot of questions to, because we are also asking them questions about, do you have enough PPE? Do you have enough hand sanitizer? Do you have enough cleaning supplies? Do you have any concerns, you know, from a COVID standpoint? So we're not tasked with inspecting that, like Chris mentioned, but we're certainly asking those questions. And sometimes we see like relief that, okay, somebody's asking me this, somebody's in touch, you know, not at a distance and not what we used to be able to do. But so far, you know, as long as we're being reasonable with the labs, the interaction has been really positive.
That's great. Yeah, it sounds like this might also be a kind of silver lining, a chance to really build relationships with people and have them develop and see you as more of a resource for their safety, and as opposed to just sort of this adversarial, more common relationship that can form. Chris, it looks like you are muted there. I'm not sure if you were trying to chime in.
No, just agreeing.
Great. I actually did have a question for you because you mentioned spot checking earlier as part of your increased responsibilities. Have you found that that's been well received, or is that more kind of a similar to the way that spot checking, I think, used to go with, you know, hey, where are your glasses? Where's your lab coat? How come you're, you know, not wearing this or that? Is that different?
So really it's been, we haven't been, putting it, really out there that, we're here to check and make sure that you're doing, that you're following your face covering guidelines or distancing. We've really tried to make sure that the approach we're taking is, we're here to provide you guys with resources. If we do see something, we will obviously, talk to the lab about that, mention, the, absolute imperative that, we need to have folks following the guidelines because, again, campus leadership has been pretty clear at UCLA that, if we start to see a, uptick in transmission, they're not going to hesitate to shut down entire buildings. Just making it really clear to the researchers that, we're there to make sure that that doesn't happen. In general, I would say it's been pretty well received.
Great. Yeah, it seems like now really upper leadership are starting to understand that safety is just critical to operations and that you don't have safety, you don't have operations. Great. So Angela, I had a question for you. So how do you balance the human element of inspections when COVID is causing so much stress around indoor spaces?
Yeah, so that's certainly been a challenge. And I think what we've been really sensitive to, while it's not things that we're formally asking in our checklists, we start off any inspection that we're doing, whether we're talking to someone over the phone about something or actually physically doing an inspection, we're kind of incorporating some informal questions about wellness, letting them know that there's resources available if they're having any challenges or if they need help. We ask before we start any kind of inspection activities, again, if they have all the supplies they need, the PPE, the hand sanitizer, cleaning products, and if they don't, or if they have some concerns, we put them in touch with the people who can help. We just ask if they feel like their distancing and their lab plan is working okay, that people are wearing, the appropriate face masks or coverings, and if they have any questions about that. So I think that just starts it off as a good tone. And again, we schedule everything ahead of time and have that communication. And so, for example, when we we're considering instituting some limited inspections back in June when things kind of ramped up a bit more here, we actually reached out to biology and chemistry were two pretty large departments that would have been inspected in the spring that we certainly couldn't inspect then. But we still wanted to make sure we did some kind of limited walkthrough or inspection to just look for some high ticket items in those areas, particularly chemistry. So we actually reached out to the department chair and the contact for those departments and said, here's what we're proposing. We'd like to do inspections, but it's probably only going to be about this % of the labs, and these are the things we're going to look for. Does that sound like an okay plan? And so we wanted their buy-in and to be partners in that. We are also really focusing on if there was something right then that could be immediately addressed by one of my team members in the lab, then we were just addressing it right then and helping them through it instead of saying, well, this is a gap, we're going to document that and come back. We still may put it in the inspection report, but we put it as resolved. So just again, wanted to make sure that we're partners because we realize people are under a lot of stress. And for us, it's a much different feel on our med campus that ramped up sooner because we're affiliated with the hospital and there was always activity here versus our more traditional campus where people were coming back much later in the game and they hadn't been to campus yet. And there was just a lot of unknowns for them, right? And so you just want to make sure that you're sensitive to that. While we had been here kind of working through this and had kind of gotten used to all the protocols in place and what we needed to do and the check-ins and the masking, we constantly have to realize that there's people that are just coming to campus and this is very foreign to them. And so I think it's, again, just being sensitive to some of that and just kind of walking them through everything. So again, I think that's gone, relatively well when we certainly take that approach.
Great. So just to build off that quickly, because you mentioned finding resolutions and then getting into addressing something immediately. So Chris, my question to you here is, are you handling inspection resolution differently as well, or is that something that's just happening the same?
Sure. So we, in terms of we did have a few inspections that were outstanding when, campus shut down. And for those, we definitely, did put a hold on, resolving those since folks just weren't on campus to make any progress towards that really. Since the ramp up has started, we have started to try and wrap some of those up. But we are making sure that we're doing this in the context of a dialogue with the labs, that we are sensitive to their needs, that they may not be able to address things as quickly as they would have in normal times. So yeah, and then in terms of the spot checks that we're doing, at this point, when in the few cases where we have seen issues, the resolution has just been for me to send an email to the responsible faculty, just letting them know what we saw and kind of reiterating the importance of them communicating to their staff what the expectations are.
All right, fantastic. And then just another question to you, Chris. So we spoke a little bit about limiting resources and, kind of what was that big bottleneck on the process. But of course, it's not just one thing, it's a lot of things. So what have you found you've had to do in terms of trimming the fat from your inspection program in order to adapt and really still find that sweet spot of doing the most that you can?
In terms of the spot check, I mean, we've trimmed more than fat, right? We've been forced to, trim some muscle as well in terms of what we're able to look at and survey during those. And then with the self-inspection program that we'll be launching, one of the things that we did is we went through our existing checklist and just looked at our database over the past few years and tried to eliminate things that we just haven't seen as problems in the labs very frequently. And also things that, just really don't have a particularly high safety value to them. And, trying to consolidate some of the documentation items and just make it a little more user-friendly since, by and large, the folks that are going to be completing these checklists are not trained safety professionals.
Great. And then do you have just, of course, like some sort of process in place so that way people can raise those flags, get those resources they need, again, ask those questions where if they encounter something where they're not sure how to handle it, they can really feel confident that that's going to get resolved?
Yeah, absolutely. So the system that we're going to be using for our self-assessment process does have a option for a dialogue that can be started. And then the other thing that I think helps with that is, as I mentioned, we've got those QR code sheets that we've been handing out. So yeah, people should always know someone that they can reach out to in our office to get some help.
That's a great idea. We've heard several people and across the course of our conversations mentioned that those QR codes are really just when you're not able to have as many people to ask questions to and have that nice remote resource that you can access very easily.
Yep.
Great. So Angela, next question is coming up for you. We've heard a few different webinars on those that individuals are so focused on coronavirus risks that they just sort of look past the risks that are happening in the laboratory, be it chemical, biological, sharps, flames, all that fun stuff. So what do you do to kind of help bring people back down to earth and keep them focused on the dangers to their health as opposed to just being hyper-focused on COVID?
Yeah, so I don't know if I have like some kind of mind-blowing answer here, but I can speak. So let me speak to a little bit of it. So that's certainly been a challenge. I would say similar to the time challenge that I mentioned, that PPE, pre-COVID's a challenge, and then now in COVID is a challenge. And so we've now added, we have this added measure of wearing a face mask or face covering. And I've had some experience where I've been in an area and I'm like, wow, everybody's wearing their face mask, great, but they don't have any other PPE on, right? And so it is true. People are so focused on the COVID protocols and the fact that they're in this space and they have to be mindful of distance. They're wearing an additional piece of material on their face, and then hopefully all their other PPE. They're constantly aware of trying to wash their hands, hygiene. Most of the spaces have implemented enhanced cleaning, right? And so when they probably weren't wiping down surfaces as much as they are now, so it's another task. And so kind of one way we thought we could hopefully get people to remember, right, all the other safety factors is to restart our inspection program, right? So we restarted it in that limited manner because we did want to just make sure people were being diligent about, the normal day-to-day safety. We've had a couple incidents in the last month related to eye splash in the eye, and put out a couple reminders on the importance of safety glasses. Safety glasses have been particularly challenging because depending on the face mask or covering that you're wearing, they can fog up. People get kind of irritated by that and then they take them off. And so luckily these didn't result in some kind of major damage, but it certainly was eye-opening to us. And then communication's been really important. While we were ramped down, we were really trying to stay in regular contact with our lab contacts to say, just even if it was just a touch base. And it wasn't, a generic email blast. It was each one of my people, their particular contacts, sending them a message, just checking in, seeing how they're doing, asking if they have any concerns, hoping that as we moved into that ramp up phase, keeping in touch with them would allow us to then touch base on safety. So, really restarting our inspections, doing what we could virtually with our labs, just touching base on, we can check the inventory without needing to be there and say, hey, we kind of noticed this, or hey, can you look into this? If we did a walk by and we noticed something, we could touch base without needing to spend a lot of time in their space. But I would say it's an ongoing challenge, and they're not separated from each other. We're seeing very real safety concerns that are tied to the new protocols we have in place for COVID, right? So if you can imagine, if you're back to up to 80% of research capacity like we are, one of the ways to get there is by having shifts and doing work over shifts and on the weekends. And so a lot of universities are challenged with that right now, where people kind of working around the clock because they can only have so many people in their lab, but they need to do this much research. So that creates these very strange boundaries between shifts, right? So I'm leaving, like my shift ends now, and we've had some concerns with people kind of rushing to get done. And that's not necessary, right? I mean, obviously they're concerned about the next group coming in, but probably, not as concerned as they need to be, right? You can still maintain that separation. We don't want people rushing. So we're really trying to see how are kind of the COVID protocols, causing some of those. And the other big thing is lone worker. And so, lone worker existed, or working alone, or however you want to term it, obviously existed before the COVID pandemic, but it has been exacerbated by this because we have more people, performing tasks alone. And so that was highlighted in our ramp up documentation that labs were supposed to do, but we are actually now working towards a more formal policy and program for the university. We mentioned lone worker in our chemical hygiene plan, but we don't have a separate policy. And we're looking at ways and different tools to help people manage lone worker. So one of the things we're looking at right now is an app-based tool that allows people to check in with someone if they are working alone. And so, so we're trying to do some of that, and just that kind of constant communication to people, honestly, is is really what we're trying to do. Again, personally with our lab contacts, because unfortunately labs are just getting bombarded with high-level emails every day about something. And so you really have to kind of maintain those personal connections, because I'm just not sure they can manage all of this information coming at them all the time.
Yeah, there really is just
like the amount of emails coming from all the different groups you're a part of. I don't know how anybody's keeping their head wrapped around all this stuff.
Yeah, on top of just general life stress that also really.
Yeah, in life, you know.
Yeah, Chris, it looked like you were nodding along with quite a bit of that.
Absolutely, yeah. Same thing, right? You know, we emails just, I mean, even before COVID, right? Email wasn't a great way to stay in communication with labs. And yeah, now that they have chancellors and vice chancellors sending them, you know, constant emails about, you know, where campus stands, you know, it is, like Angie said, even more important that we're, you know, able to have those conversations with people, and, you know, again, be a personal resource.
Yeah, I think that is really the key to finding that introduction, is just when you're stressed, when you're feeling taxed for time, the things that you're going to be paying attention to are the things you feel like are going to help you and add and deposit for you and not withdraw. So being able to leverage that relationship seems like it would be a great way to do that. So before we move on to our Q&A, we do have one or two more questions here. I just wanted to make a quick reminder to everybody that there is a Q&A option down in the Zoom control panel. So you can go ahead and click that Q&A button. It'll pop up a different window where you can thumbs up the questions that you're most interested in, ask questions that we can then review in the live Q&A portion of the webinar. There's also a great feature where you can respond to each other's questions. So if you see something you have experience with, if you'd like to build off of another person's question, ask for any clarification just because you'd like to learn more, you can have those cross conversations and you don't have to rely on us to address the things you're interested in. So it's something that I know people have really enjoyed in past webinars, and just wanted to point you towards that as well. So before we move on to the Q&A portion here, Chris, last question for you here is what advice would you give to groups that are struggling to keep up with the pace of inspections right now?
I mean, the biggest thing I would say is if you have the flexibility, don't try and keep up with, you know, the pre-COVID pace. You know, these aren't normal times, and you know, running your team ragged to you know, try and keep up with that, just, you know, it's not going to work out in the end for anyone. So, you know, I would say, you know, try and be more strategic about, you know, what you're looking at. You know, if you absolutely, you know, have to continue doing your inspections at something, you know, close to previous rate, you know, maybe make sure that, you know, you're prioritizing, you know, what you're going to look at, or that you're prioritizing which labs you're going to look at. You know, and you know, this may vary depending on kind of what specialty you're coming from, but you know, certainly for the, you know, chemical team, if, you know, we were doing our regular inspections, you know, we would want to, you know, make sure that we're visiting some of the chemistry labs, maybe a little bit more than some of the microbiology labs.
Great. And then in terms of prioritization, do you have a particular hierarchy or kind of decision tree that you follow when you're looking and trying to figure out how do we prioritize one over the other?
We've looked into that in the past. I can't say that we've ever come out with a completely satisfying, you know, rubric for that, but you know, factors like, you know, what kinds of hazards they have in their space, factors like previous safety performance, you know, those are some of the big ones that I would say you'd want to look at.
Great. All right, Angela, do you have anything that you wanted to add before we move along? All right. So just a quick plug before we move on to our Q&A here. So we do have upcoming webinars. We try to keep these relevant for everybody. Coming up next, we have one focused on bathroom safety, kind of understanding what risks, if any, bathrooms might pose to people. We will have one talking about communication, you know, when there's this global pandemic happening, getting our safety experts a chance to weigh in on important issues as they're being decided upon. and a new one coming up here talking about engaging and delivering training during the pandemic. So really excited to have all these on. We'll have some great speakers lined up. And this time, rather than having our normal poll asking you which topics you're interested in, we have this word cloud here. So great to have anyone who's interested go over to menti.com, enter in this code 715159. We'll go ahead and toss that into 596 into the chat. So that way you can just go ahead and copy and paste it in. And it's just great. It's cool to see these things. We already have quite a bit of participation here, so we'll be revisiting this again, but really nice to see what's on everybody's minds. And these are the community webinars. They really rely heavily on you, our community, in order to have them keep going. And one of the biggest limiting factors is our panelists. So again, a huge thank you to Chris and Angela for joining. And if there's anybody out there who is interested in being a panelist, even if it's not for an upcoming topic that you see here, but just you think it would be kind of a cool thing to do, or you have a colleague who might be a really great fit, it would be great to meet them, to get a chance to have them on. We really try to keep these webinars very lightweight for everybody because we know how taxed everybody is, and appreciate any help that we can have to keep these going into the future and keep serving you and your needs. So we'll keep this up here just so that way folks can still participate in our word cloud if they're interested, and we'll check on that every once in a while. And in the meantime, we are going to switch on over to the Q&A. So just to go ahead and kick things off with Robin's first question here. Robin asked, if conducting in-person inspections, how do you address the management of de-densification requirements within the laboratory? So things like max occupancies during COVID. E.g., having an inspector in the same space reduces the number of lab personnel that's permitted, at least during the time of the inspection. So Angela, it looks like you already got a brief comment in there, but is there anything you wanted to add to that?
No, I mean, for us, because we really ramped up our inspection process slowly, when we were at the first phase, our orange phase, which was just, I think, up to 30% research capacity, we weren't doing inspections then beyond just very limited, we'd call them kind of compliance checks. So that was just for very particular labs that had substances or something that we just felt like we needed a quick check on. And so, you know, that would have been the more challenging. Now that we're up in our yellow phase and there's more research capacity, we're just not really running into those density issues. We can usually find a time where we can be there and people are either on lunch, or we can just do it earlier in the day, or kind of at that shift change, and we haven't had too many issues. That's the same for like our folks who are picking up waste. They do it very, very early in the mornings before anyone is actually really in the labs. And so we have been able to kind of eliminate concerns. So for us, it hasn't been as much of a challenge just because of where we're at right now in our ramp up.
It seems like having great visibility into the schedules, making sure that those schedules are adhered to is a really useful tool for you there. Chris, anything you'd like to add before we move on to the next question?
Just to say that I definitely agree with that sentiment, and that was really one of the major motivating factors in our decision to not resume our regular inspection program when our campus went from our initial phase 1 essential research only to the phase 2 still very low density.
Great. Next question here is from Jack. Jack would like to know, what are some changes, if any, that you've made to your checklists or findings in order to adapt to the limitations imposed by the current pandemic? And what have you removed or added or modified? So it sounds like kind of honing in a little bit on the specifics of what's changed.
Go ahead, Chris.
Sure. Yeah, so, in terms of the spot checks that we're doing, we cut almost everything from our checklist and replaced it with the kind of infection control type issues that we were looking at. In terms of the checklist that we're going to be making available to the researchers for their self-assessments, this is what we've done there. I think, as I mentioned before, is really trying to remove issues that we don't see in the labs very often, and issues that even if they do kind of go unchecked, are not very likely to cause a major problem down the line. And then in terms of modifications, we have tried to combine some findings into larger grouped findings. So maybe a little bit less granular about all of our different chemical storage findings from the checklist that we use, and just ask folks to check for incompatible materials and proper secondary store containment.
Yeah, and I think ours is similar to what Chris mentioned. So before, when we were just in the phase where, prior to our initial phase of ramp up, where only critical research was occurring, which was very limited and mostly COVID related research, we implemented what we called like a safety suite program. And so these were just quick walkthroughs of buildings, really just at a high level. We created a little online form to, kind of, do we see something? Do we smell something? Do we hear something? And just doing quick walkthroughs to make sure nothing seemed unusual in some of our spaces. So there really wasn't anyone around, and we could do those very quickly. And then as we ramped up, we started doing a modified inspection. So we retained our existing inspection checklist, but we just NA'd certain sections. We do all of our inspections like on an iPad. And so we really focused again on just the high priority items. So if a lab had a controlled substance, if a lab had certain funding that required something, we were hitting kind of those items, looking for any waste that was overdue for submittal, and any, just again, a kind of a major concern, right? We weren't focusing on some of the minor things. And then as we've now shifted into, I would say, relatively normal inspections, because of where we're at, we did remove, like how Chris mentioned, some items that just haven't really been an issue, so we could try to simplify that. I will say one of the disappointing parts of it is that last year we had put in a question on our inspection checklist that said, did anyone besides the lab contact participate in the inspection? Because we were really trying to get more participation, and we were actually going to give bonus points this year for people who had more participation to try to, again, be focused on culture and not compliance. And so unfortunately we had to remove that question this year because we obviously can't ask for more participation. So that was kind of a disappointing factor of how we had to revise our checklist.
Great, and I will just add here, this seems like a fantastic question to have you, our attendees, weigh in on. I mean, I know there are a lot of people who are doing inspections and who are having to winnow down those lists in really painful ways. So it would be great to have you go and reply to Jack and let him know, what are the things that you've been removing and that you've, felt like those final last few things that you tried to figure out, like, oh, can I really trim this? Can I not do this? Great to hear those responses. Coming up next, we're gonna skip ahead a little bit, and next question here is from Azil, and they would like to know, how are you addressing deficiencies found in labs that are unoccupied, where the PI or the group lead might not be returning to campus until possibly 2021? So is that something that's kind of come onto your plate, or a thing that's been on your radar at all, or maybe not as much of a concern?
Not really for us. We're pretty much not going into labs that are not occupied. And pre-COVID, it was not our practice to conduct an inspection if no one was around. And we've continued with that.
Yep, same. So we do have some PIs that haven't come back yet from a research standpoint. And so we're not inspecting their space. What we do is when we're in that area, if we have other inspections, every lab was expected to put a ramp down signage on their door to have what task could be occurring. So if somebody just has to come in and do a check of something, so that we can at least see, hey, does that make sense? Do we see any concerns just through the door, or if it's open, just open briefly? But we're not, if they're not there doing research, then we're not doing an inspection in those spaces.
Sure. And then just a question for me here. I was wondering if there were any processes in place to ensure that sinks and other plumbing devices still had their U-bends full. I know that in some cases, empty U-bends were a concern for transmission for aerosolized virus, but that might be more on kind of the bathroom plumbing side than on the sink side.
Yeah, I'm not aware of any consistent program that we've had specifically aimed at that.
Okay, great. Moving on here to Carolyn's question. Carolyn would like to know, how would you approach an inspection due for a facility that is in peril financial crisis due to a lack of funds from COVID? She doesn't want to put more stress on the director or manager, but also, doesn't need to do it for a job.
I'll try to answer. So I don't know if we haven't specifically ran into that, but what I would say is, again, I would come from the approach of trying to help them, right? So, I mean, we are not a regulatory agency, right? We're internal. There are researchers that we're trying to support. And so we're there to help prevent, right, any kind of regulatory issues that they might run into, hopefully help prevent maybe some kind of safety concern. And so if they're already under financial stress, a safety incident or a loss of property or some kind of infraction is obviously not going to help that situation. And so that's how I would approach that, shouldn't be a burden because you're trying to help prevent something. After we ramped up to our yellow phase in July, 3 weeks later, we had an inspection by the Missouri Department of Natural Resources, a hazardous waste inspection on our campus, 3 weeks after ramping up. So again, we're there to make sure that, or help to ensure that suddenly we weren't going to have a bunch of waste infractions, and luckily it went fine. But we were, that's kind of how we have that communication, is we're trying to help make sure that you don't run into any regulatory issues or hopefully any safety issues, but loss of, property, injury, anything like that is obviously a huge burden on top of lack of funds that, you just don't want to have happen.
Yeah, the only thing that I would really add to that is, at least for us pre-COVID, most of our inspections didn't, create a situation where the PI was going to have to go out and spend a whole bunch of money. So, that really wasn't something that was very much on our radar. And, if that ever had come up, our approach would have been to, work with that lab and, try to find a way to get them the money that they need to keep operating safely, right? Work with the PI to go to the chair, the dean, whoever it is that might be able, to provide them with the resources that they need.
And then if I'm remembering correctly, Chris, you made a comment earlier that at UCLA, if there was any indication that cases were going to be rising, there would be no hesitation in ramping research back down if it was necessary. And I think, Angela, to your point as well, just reminding people that, research, that safety is not like a nice to have or kind of that compliance stick you're trying to do. It is critical to research, and that if you're concerned about safety, then you have other large concerns as well. It's a great perspective. So just before we move on to our next Q&A question, going to go back to our word cloud, kind of see how things are changing up here. I'd love to hear from everybody. If you got a minute to go ahead and visit menti.com, enter in that code, and you'll be able to participate and let us know what you're interested in. So really neat to see all these different ideas here, and we can keep this up for a little bit for our next one as we're going. Next question here is from CS. They'd like to know, have you received any pushback from researchers doing self-audits?
I'll get back to you, and I can get back to you in a couple of weeks on that. Thus far, we've let our faculty safety committee know that we intend to launch this, but we have not advertised any further out to the rest of campus that we're going to be starting this program. So we'll see.
Great, and that's also a good opportunity for anybody who has experience in managing self-audits, either before the pandemic or during it. Go ahead and get back to CS, let them know how you're doing and what's been successful and what hasn't. We've definitely heard that doing self-audits can really increase engagement with safety and give people more of a sense of ownership. So that's kind of another nice benefit on top of not needing to have somebody come into the space. All right, next question here. It looks like it's already having a little discussion here, but we'll go ahead and touch on it from Paula asking, have you put barriers between fume hoods that are side by side so people don't worry about being too close to someone? So any concerns about those proximal research locations?
So, and I think Christy had a good comment that that could impact the function of the hood. So, so no, we haven't. So in our laboratories, we are using barriers in a very limited circumstances in what we would call kind of pinch point areas. So our expectation is that people are at least 6 feet apart. That is regardless of any kind of barriers. So we took us kind of a big hard stance with our facilities team on campus, on both campuses right away, just saying we're not going to install a lot of barriers just all over the place, because we had people that wanted barriers essentially from like bench top to the ceiling. And so the expectation is that you're 6 feet apart and you schedule density and work accordingly to maintain that. We certainly have areas where we have had to utilize barriers just based on the layout of the lab, but we have not done that in a fume hood. So if we have 2 fume hoods that are next to each other and you can't maintain 6 feet, then you're just not going to work with 2 people in the fume hoods.
Yeah, and that's pretty much the same for us, and especially given the fairly severe occupancy restrictions that we're still working under. That's just not really something that we're concerned about occurring. I know there have been some conversations about around barriers for some of the instructional labs for when those start ramping up. But yeah, not for research labs.
All right, great. And going on here, there is another question here from Paula asking about face coverings for chemistry staff. So are you involved in providing face coverings for your staff? And if so, are there a particular type of fabric that you're using for those, or just sort of trying to set up rules about people bringing in their own things?
Sure. So the face coverings that UCLA has been providing to all of the staff are cotton, and we're not overly concerned about that in the chemistry areas, since that is, a natural fiber, and it's, not likely to, melt in the event of fiber, and it's not likely to absorb any significant amount of chemicals. So, we're pretty satisfied with folks, who want to wear that type of face cover. We have, through our PPE supply store, purchased some FR face covers for folks who are particularly concerned and want to use those. But that's something that they're going to have to purchase if they want to use that.
Similar, we actually don't supply PPE, so like EH&S doesn't. We do have some central supply of disposable isolation masks that we're asking people to utilize when they work around hazardous materials, but in regards to concerns around, say, flammability, and in our chemistry labs, the communication from chemistry has been like kind of what Chris said, natural fiber, right? So cotton is usually an obvious choice. I'm not aware if they've purchased any FR. It's possible that they have. The other discussions in the beginning, especially when we were at limited ramp up and you'd have very limited people in the lab, is that typically the areas where they were doing that type of work, were pretty, I don't want to say isolated, but the labs are pretty large. And so they also just set up a different set of rules so that somebody could be potentially working in that area and the nearest person was, way further than 6 feet away, right? And so if we ever had a situation where we were concerned about the face covering, we were trying to manage it by, that greater distance. So it's kind of a combination of things trying to work, but I think the natural fiber is the similar direction that we've been going here.
All right, great. Going down here, looks like there's a question from Anne asking more about the lone worker policy. So Chris, I believe you were the one who was talking about having that app you were using to communicate with lone workers. Am I remembering that correctly?
I think that was Angie.
Oh, Angie, dang.
Yeah, so I mean, I don't have a ton to share policy-wise. So, I mean, I've been in academia 2.5 years. So before this, I was consulting, and before that, I worked for the Eastman Kodak company. And I think, in general industry and in other industry, lone worker is just this known thing, right? Like everybody had you have a lone worker policy, and you have tools to help you manage it. So like at Kodak, people wore like monitoring devices. And so that we knew if somebody went down. Now, obviously that's not necessarily reasonable in a research environment. So when I started here, I noticed we mentioned lone worker in our chemical hygiene plan, but the terminology is soft, right? So it should, right? You shouldn't do this. And so what we're trying to do is have a more formal program around it and people a little bit more direction on how you can manage these lone worker scenarios. And one of those tools that we're evaluating is an app that is allows you to have you set up what's called a lone worker session that starts. You have your primary contact. You could call it your emergency contact or your buddy. You're expected to check in on the app on a certain frequency that you set, and if you don't, that buddy is going to be contacted to check in with you, right? And then it escalates from there. So we're just in the testing phases of that, but it's a tool that we're considering to be able to offer our researchers. Our chemistry department has shown a lot of interest in it. And honestly, I will say, this has been in discussions for a couple years, and starting to actually get concerns from research labs around these lone worker scenarios because of COVID actually made it a little bit easier to sell developing this program than I think it would have before. Because again, it's just not that common in academia to have that. I mean, if you search around, and I'd be happy to share what we found, but you can count kind of the number of universities in the US that address lone worker. Now, if you search in Canada and the UK, it's very common to find those programs. Here it's tended to be a little bit more embedded. So we're on a journey. I think we're on a journey. If my boss asks me what keeps you up at night, the kind of question, and you probably all may have a similar answer, it's the people who are working, it's like, I see the lights on. I know there's people working there at weird hours of the night. I mean, that's kind of the thing, is how do we know it's happening, right? And so how do we give people tools to help manage those situations?
Fantastic. Great. Well, I just wanted to make a quick announcement here that we have somehow made it all the way to 4 p.m. Eastern, or Eastern time, gosh. And we understand that's when we have the webinar go down here. We do usually have enough questions, like right now, to go on quite a bit longer. So we ask our panelists ahead of time if they're able to stay for that extra 15 minutes. But of course, being in safety now during a global pandemic, things change. So just wanted to check in, see if you're both able to stay on or if you need to get going. And of course, thank you so much for your time and generously, volunteering to be a part of this.
Yeah, I can definitely stay on.
Mm-hmm. Yep, sounds good.
All right, fantastic. Let's go ahead and take a quick look at our word cloud here. Looks like we got some pretty fun updates. Still, yeah, lab ventilation really seems to be on everybody's mind here, as well as training, chemical storage and chemical safety, really up there, other types of training compliance, and just generally seems like keeping buildings safe is pretty up there as well. And transitions us pretty well into our next question here from Penny, who'd like to know, if researchers are not present, is safety equipment still checked, like eye washes, showers, and spill kits? And what about checking chemicals for integrity of containers, such as peroxide formers, everybody's favorite there, et cetera. So I know that you spoke previously about generally staying away from unoccupied spaces, but whether there are still some kind of critical things that get checked routinely.
Yeah, so the eye showers and the eye washes and safety showers, those are generally pretty easy to check as you're passing by. And at least at UCLA, for better or worse, we're not at a position where we necessarily have those inside the labs in all cases. So, for the ones that are in the hallways, those are pretty easy to check whether anyone's kind of around or not. In terms of if the researchers are not present on the other items, though, That's certainly potentially more of a concern. At this point, that hasn't really come up too much, just because we have about 800 different research groups that we inspect, and I learned yesterday that we've had 1,000 return to research plans that have been approved. So folks not being around really hasn't been a big thing here.
So for us during March, April, so before we actually ramped up, we gave an allowance for labs to not have to do their in-lab. So anything that's out in the halls, those are being inspected by facilities. So any showers and eye washes that are in the hallways, but the in-lab showers and eye washes, if they weren't present and they weren't doing any activities that necessitated their use, we were giving them a pass on that. But as soon as they had their ramp up plans in place, then the expectation is that they would have to start checking those again. So we haven't seen too many issues. A lot of the labs just went ahead and checked them because they typically at least had one person coming in to maybe check, check a piece of equipment or check levels on something, even if it was just for 10 minutes. And so they were going ahead and doing that. So I think it wasn't that many cases where people were needing to skip it altogether. We haven't seen many issues with chemical integrity. And it's probably just because we weren't ramped down that long, and starting in May, before we started ramping up, our environmental compliance group went ahead and did waste sweeps of areas just to get some of that out before the researchers even came back. And so normally it would be on the researcher to fill out the request and all the paperwork. And so what we did is essentially said, you know what, we're just we'll do it for you. We're gonna go in, we're gonna see if anything's coming due before you come back, and we're gonna address it. And I don't think we had any issues with any kind of integrity concerns, because ideally the labs were addressing that in their ramp down.
Great. And then just from my own curiosity to kind of follow up on that question about peroxide formers, chemical containers, and you mentioned waste. Have there been any particular classes of inspection findings that have gone up in more frequency that you just, anything that comes to mind that, might be good to keep an eye out for?
So one thing that we've seen a little more often has been some PPE violations during our spot checks. We were actually, I think, doing pretty well prior to COVID. So I think maybe it's just, removing that kind of positive peer pressure aspect, right? And folks are, kind of working by themselves or with only a few other people. Maybe they feel a little less pressure to, be in PPE like others. The other possible reason for that is, traditionally our inspections had been announced, and the COVID related spot checks have been unannounced. So that may also be contributing to that.
Yeah, I'd say we're in the same boat. So PPE's been a little challenging, and I think I mentioned that before. And it's just hard to say kind of what's attributed to that, oh, maybe no one's around, so I'm just gonna wear whatever. Might be part of it, but we have struggled a little bit, and so it's just been good reminders to people on their PPE. Otherwise, I don't see anything right now standing out, but we honestly are at this fraction of normal inspections for the fiscal year. Normally for us, waste and kind of waste compliance is a big one, but I think because we were being so proactive about it, because we had these regulatory inspections, that it really hasn't been as much of an issue. I just think people aren't generating as much waste in the labs, and so maybe it's a little easier to manage.
Sure, great. Thank you for that response. And just gonna get over again to our word cloud here. So take a look at what people would like to see. I think it's just always nice to kind of check in, see what pops up here. Self-inspections, virtual training are up there, ventilation, again, communication, flu shots. definitely on everybody's minds right now, the compounding thing. So I'll leave this up for a little bit while we keep chatting. Just wanted to share this one because I think it's always nice to get these out. John says this has been a really helpful webinar to confirm that we're on the right track. Thank you very much to the panelists. And that was seconded by another one of our attendees. So I know that those sentiments are always very strong, and just wanted to reiterate thanks for your time here. There was a question here from Christy, wondering how many staff you have. She mentioned that 700 PIs assessed once per year is very impressive.
Yeah, so I have 4 health and safety professionals on my team that conduct the lab inspections. And then I have 1 person who manages our chemical inventory and some of our training related things. So not a very big team. So that means each person is needing to do around 150 to 200 inspections. So most of their time is spent doing that. We do though have a program in place for good performance, right? So if people are kind of consistent high scores, we may skip them. And then because of the ramp down and phase ramp up, we modified that a bit. And so we actually allowed for a wider percentage of good scores to be skipped and looked at a little bit of their inspection history. And so we had been skipping quite a bit more labs. But yeah, it's a heavy load. I'd love another 1 or 2 people. But yeah, it's a lot. And honestly, I'd love to be more, we'd like to spend more time in the lab. And so as you can imagine, as you keep adding on those spaces and PIs, you kind of have to keep ratcheting down that overall time you're able to spend unless you get more people, right?
Great. And while I look through here, of course, both of you feel free to highlight any questions that you're particularly interested in that you'd like to hit before we move on. So I'll just pause there for a second and give everybody a chance to kind of look through the Q&A, respond to any questions. Again, one of the things that I love about Zoom webinar here is that you can respond to each other's questions. It's not just an isolated, vacuum Q&A. And we have this fun word cloud to just sort of get a sense of what's on everybody's mind here for content. And we have upcoming webinars that you can go ahead and register for now on our EHS webinar homepage. I'll go ahead and just post that link into the chat. I guess I can't. I forgot. 2 different computers can't actually meet up. So fortunately, that one's pretty easy to get to. So top question here is from Sabine. I'm not sure if this falls into your areas of purview, being an inspection webinar and all, but she was wondering, how are your labs handling training of new employees or students and supervising them while they're learning?
A few years back, we moved our general lab safety fundamental training online, so that has not been impacted by COVID. In terms of the more lab directed training, basically what we're asking labs to do is, as much as possible, try and maintain that 6 feet distance. Make sure that everyone that's in that space is wearing their face covering, their proper PPE. That folks are completing their symptom monitoring survey so that they're not coming to campus if they're not feeling well. And yeah, that's really been the main focus of our approach for that.
All right. And moving along here, Corey just had a quick question in the chat wondering about the webinar being available to listen to after today. So definitely, we try to get these up before the next coming Monday, and the recording will be available down at the bottom of that EHS webinar homepage. So very easy to navigate to all of our webinar recordings. Those are all completely free and available to listen to. We really want to make sure this information is as available as possible to everybody. So keep an eye out for that, and if you registered for this webinar, which everybody here has definitely, you will get an email letting you know when that recording is available. All right, and then we have 1 minute left. So rather than asking another question, which would probably take us over, are there any final thoughts that Christy or Angela would like to share before we say goodbye?
I guess the one thing that I would just wrap up with is, as I think folks heard today, our institutions are taking kind of very different paths, to dealing with inspections, but that's not that's okay, right? That's we're in very different places in terms of how the pandemic is progressing, what the constraints are that we're under, both institutionally, and what's coming down from some of the state and local authorities, and that's those constraints are changing constantly, and really we just need to make sure that our programs are adapting to that as things change.
Yep, I would just echo that with Chris. Like, we just have to be flexible. And so what we're doing right now may need to change in a month. And so we're just having to kind of think on our feet and just keep in the back of our minds that, our priority is the health and safety of our employees, right? And being good stewards to the environment for our university and all the different initiatives that we're working on. And if we keep that in the back of our minds, I think you move in the right direction. So far for us, inspections have been going okay. We'll see how things go in the next month, and they may have to change. And so it'll just be interesting to see how we need to adapt to that. Hopefully we're not all changing our jobs. We all have like our COVID jobs and our normal jobs, and hopefully we're not. My hope is to not be like involved in making hand sanitizer again. So if I don't have to do that, I'll call that a win. And hopefully we can kind of stick to the more kind of normal health and safety things. But I think if you're just flexible and you go with it, and then I'd say just reach out. Like, we're all part of this community, and a lot of us are involved in like SHEMA and AHA and are on these webinars. You have our information. So I think it's great to just hear what everybody's doing and just reach out and talk through it.
Fantastic. Well, a huge thank you to our panelists for joining us today and for donating their time and expertise. I mean, this has been a really fantastic webinar, and I appreciate all the work you've done. I'm sure we'll be hearing quite a lot of applause if everybody here was unmuted. A big thank you to all of our attendees for joining us for our word cloud today. It's going to be really useful for me trying to still find those helpful topics for everybody going forwards. And another webinar under the books. So thank you so much to everybody for joining. It's great having you, and I hope to see you again in 2 weeks.